Good morning, everybody. Thank you for joining today's Microsoft Marketplace Customer Office Hour. My name is Justin Royal, and I'm the Marketplace Community Manager. I'm here with you today on a session for healthcare innovation with Dragon Copilot and Microsoft Marketplace. So we will get started on our topic today in just a minute, but before we do that, just want to share a few quick reminders. We do have a monthly customer office hour for Marketplace. So this topic today is just one of the many offerings that we have in our customer office hour library. If you're interested in accessing the full library of customer office hours, you can visit that within the Microsoft Tech community. So the link is up here on the screen, and I'll just read it out as well, aka.ms/marketplace customer office hours. So again, if you haven't visited our Marketplace Customer Office Hour series, there's a link to do that. So we will have time for Q&A today. So just a reminder for those of you joining us live, save your questions till the end, or put them in the chat throughout today's session. We will have time at the end for our Q&A with our panelist. And if you're watching this on demand, don't worry, you can still engage with us through the tech community. We will have an opportunity for you to put questions on the actual event page. And then after the event, we can come back and answer your questions. So welcome questions live, or if you're watching this after the show. With that being said, I will go ahead and welcome today's speakers. We have my teammates Felipe and Paul joining us today, and I will hand it over to you guys to get started with healthcare innovation with Dragon Copilot and Marketplace.
Thank you, Justin. Hi, everyone, and thank you for joining us. My name is Felipe Ospina. I am a product marketing manager for Microsoft Marketplace, and I am joined today by Paul Fanning, product marketing manager for Microsoft Health and Life Sciences. And today's conversation is really about turning AI potential into real world value, because we know there's a lot of interest in AI across healthcare right now. But in reality, the question that we're hearing and that customers are asking is, how do we apply it in a way that actually improves workflows, it expands capacity, and how do we make it fit into how healthcare is delivered? And that's exactly what we will focus on today. Here's how we will spend our time. We'll start with the healthcare AI reality and why this matters now. We will then cover the key workflow challenges we consistently hear from customers. From there, we will walk through 3 high-value AI scenarios in healthcare with a very strong potential for impact. And after that, we'll connect those scenarios back to Dragon Copilot, understanding how Dragon Copilot enables these workflows inside the clinical experience, and show how Microsoft Marketplace will help organizations move from discovery to deployment by extending those Dragon Copilot apps and agents from trusted partner solutions. And then we'll finally close out with next steps and open the conversation for discussion. So to ground the conversation, it helps to start with a broader healthcare reality that organizations are facing today. And this is fundamentally a capacity challenge. Healthcare leaders are being asked to improve productivity. They're being asked to support their workforces and deliver better care, all while operating in a very increasingly complex environment. And that's why AI is becoming such an important topic in healthcare. And it's not because organizations are looking for more technology just for the sake of technology, but because they're looking for new ways to reduce friction. They're looking for new ways to expand that workforce capacity and help those healthcare teams operate more effectively at scale. So let me put some numbers behind that to understand the conversation. One of the clearest signals in healthcare data is that people simply don't have enough time, or they don't have enough energy to do that work effectively. And that tells us that the constraint really isn't about demand. It's really about capacity. And this is important because when care teams are overloaded, that impact is not just operational. That impact is showing up in, for example, documentation delays, fragmented workflows, staff burden, and ultimately the patient experience. So when we talk about AI in healthcare, we should really be talking about how to create the capacity where healthcare teams need it the most. At the same time, healthcare leaders are increasingly seeing AI, and especially AI agents, for example, as part of that answer, as part of the answer to solve those problems. But the point here is not that AI is a future concept, is that leaders are actively looking at AI as a way to expand organizational capacity. And that makes the conversation less about whether AI matters, but more about where it is creating the most value and how AI is really fitting into existing workflows and how organizations can deploy it in a way that is trusted and in a way that is also practical. So where is this pressure actually showing up? It shows up in everyday workflows in the healthcare system. It shows up in the time that clinicians are spending on administrative tasks. It shows up on fragmented, click-heavy experiences across multiple systems. And it's showing up when time is spent managing the systems rather than focusing on the patients. And this is where AI becomes really meaningful. It's not as a layer on top of complexity, but rather as a way to reduce that complexity inside the flow of care. When we step back, we can simplify the problem into three core barriers. The first one is the documentation burden, and that's essentially a lot of time that is spent creating, refining, and completing documentation. The second one is information fragmentation, and that's the data that people need is really spread out across systems, across different records, policies, and workflows. And thirdly, there's the administrative drag, which are all of the repetitive steps, for example, the handoffs and the coordination work that consumes people's time and attention. And these are the kind of problems that AI is well positioned to help solve in healthcare, especially when the technology is embedded within the clinical workflows rather than just sitting outside of those workflows. So now I will turn it over to Paul to talk about what healthcare leaders are looking for from AI. Paul?
Awesome. Thank you so much, Felipe. And thank you, everyone. I'm excited to speak to you all today and this morning. So at Microsoft, we hear from healthcare leaders from across the care continuum every day around what they are looking for from an AI solution and a partnership. And so it starts with always on support. They are looking for a partner that will be there, elbow to elbow on site, that will provide that level of support to really train their clinicians and their care staff on the solutions to be ramped up and to really be more efficient. They're also looking for speed and quality, right? They don't want a tool or solution that's going to slow their clinicians and their staff down. And most importantly, they want something that's going to generate quality, right? Both from a quality clinical score and a patient quality perspective. And then finally, they want on-demand expertise, right? Whether that's learning videos that clinicians and staff can tap into on demand, things that staff can go on site and be there for their implementation experiences. But having that on-demand sort of tailored approach really does make a big difference. And that's what our customers and what we're hearing from healthcare leaders right now from an AI perspective. Next slide. Yeah, great. Thank you. So we're going to look at three scenarios now, clinical scenarios that we see on a daily basis around where AI is making a big impact. And so the first one is clinical documentation. And so clinical documentation has been sort of front and center always within healthcare. And it has been something that historically has slowed down clinicians back from paper charting now to the EHR process. But it's been clunky, right? The hunting and pecking and clicking and tapping that really has become clinical documentation has really created that sort of cognitive burden load that Felipe mentioned before. But now with AI solutions, clinicians are really able to take some of that burden off, have some of that conversation with their patients ambiently captured so they could be more present in that moment of care, but also use AI to really surface insights, surface information in that moment to be more proactive, to take specific actions like ordering diagnosis management, referrals, all within that moment of care in that one screen real estate, not really allowing the clinician or preventing the clinician from really having to hunt and pack, or the nurse to hunt and pack for things that they used to have to be before. Next slide, please. The second scenario is care coordination and workflow automation, which is super important, obviously. And anyone who's spent time in a hospital recently or has been in a hospital themselves understands that, you know, the inpatient stay is an episode of care. And so oftentimes, or all of the time, there'll be multiple personas that come on to treat you, working you up to ultimately be discharged, from nursing staff to different clinicians and care staff. So it's really an episode of care. And so having that workflow and that care handoff being as efficient and as complete as possible is super important, right? We want that to be streamlined. Oh, yep. We want that to be a streamlined process. And so what that does is, if you can use an AI solution to really improve that note-taking, that patient interaction, the more complete the patient record can be, the more seamless the patient, the workflow and the handoffs will be between the different care staff. That obviously improves throughput, but also most importantly, improves the patient satisfaction and clinician satisfaction. Next up, or next slide, Felipe. Thank you. And then finally, clinician and care team enablement. As I mentioned before, cognitive load. We speak a lot, or I speak on a weekly basis with clinicians who tell me they see upwards of 40 to 50 patients on a single day in clinic. And so when you're seeing that many patients and dealing with that many patients and having that many conversations, being able to remember all the minutiae that happens in those conversations is nearly impossible. And so being able to offload some of that and not have that fragmented knowledge, and being able to have a solution that will capture those conversations and those little details, so that at the end of the day, the clinician or the nurse or the care staff can sign off on the note, or can remember when they're going through their process, can remember all the little things that they discussed with the patient to get that most appropriate level of care and diagnosis, and really work that chart to the best of their ability. It's empowering clinicians, allowing them to really go and practice what they all went to school for, which is to be, you know, clinicians and not documentation makers or takers. And ultimately, it's providing better patient care, which is what it's all about at the end of the day. And so those are just three quick scenarios, and how Microsoft is driving this, and specifically when it comes to AI, is through Microsoft Dragon Copilot. And this is our clinical AI solution. It's our first party product. And it's really doing three things, if you could boil it down. It's keeping keeping clinicians focused on their patients, as I mentioned before. Being able to ambiently capture that conversation allows the clinician to be more present in that moment, that nurse to be more present in that moment, really focusing on what's going on with that patient, really being in that attentive nature. It's also unifying documentation, data, and workflows. So Microsoft Dragon Copilot does not just tackle clinical documentation. There's so many other things outside of that periphery that a doctor, that a nurse do on a daily basis. Think about referrals, think about care staff messaging, think about radiology imaging, think about order management. All of those things are outside, or happen typically outside of the note itself. And so Dragon Copilot is allowing that to be a streamlined process, and allowing clinicians and nurses to do that in the moment of care. And what it's all doing, really, when you take a step back and really think about what Dragon Copilot is driving, it's reducing that friction. It's reducing that cognitive load. It's allowing your care staff at a clinic, at a hospital, to really be more efficient in their care, and really get home to their families, have more time in their day, and be less burdened. And so the three sort of, if I could sort of distill down what are some of the functionality and capabilities of Dragon Copilot, well, it's taking natural language and the voice dictation capabilities. So think front-end speech. It's combining the ambient listening capabilities, like I just mentioned, right? Being able to automate that conversation and have it sent immediately integrated into the EHR, the electronic health record. But what's really unique and sets apart Dragon Copilot from other vendors in this space and in healthcare is the fine-tuned generative advanced AI that it sits upon. So being able to naturally use your voice and query the chart, search for information, have information surface within that moment of care. It also sits on top of, as we'll talk about in a moment, has the Microsoft Marketplace integration now. So Dragon Copilot customers can now enable and purchase apps and agents to surface directly into their Dragon Copilot experience. And on top of all of the other experiences that a clinician has to do, like ordering, creating referral letters, sending a care team message, all within the integrated nature of the EHR. So meeting the clinician where they work, whether it's on a phone, on a laptop, it's a SaaS product. So wherever there's an internet connection, the clinician and the nurse will be able to access to it. So this is really what is so unique about Dragon Copilot and really tapping into the larger Microsoft ecosystem. And when you think about sort of the three, if I could again distill down sort of three categories of functionality and areas where Dragon Copilot really separates, it's streamlining levels of documentation. So meaning the clinician, the nurse can really tailor and tweak the output of their note. They can create auto text, they can create library, vocabulary words. They can really make their experience their own quickly and easily using their natural language in the product. It's also surfacing it from back one side. Yep. It's also surfacing information. So it's super important to really hammer this home for me, because if you ever seen EHR, there's multiple screens, there's multiple clicks. There's usually the clinician has multiple windows open, and it can be very disjointed. And this is pretty standard across every EHR. And so, but what's so nice about Dragon Copilot is clinicians can be in that workflow. They can have information propagate directly into their UI, not having to leave, not having a pop-up somewhere else. It's there for them, and they can use their natural voice to find information and sift through what they're really after. And then finally, it's automating tasks with a single click. I think I've mentioned this a few times, but think about placing an order, thinking about having coding information or coding advice propagate directly into the workflow. Think about a referral or an order. All of those things can be done now in a single click and then integrate directly into the EHR. And then on top of that, we now, as I mentioned before, have Microsoft Marketplace integration. So we have actual Dragon Copilot AI apps and agents in the Microsoft Marketplace available for purchase for our Dragon Copilot customers. And when we look at what our partners are really driving and where we've started in the different use case categories, it starts with revenue cycle management and clinical decision support. And I can go on and on about each of these categories, but revenue cycle management is really important. And it's a hot topic today now, because if you just look at that first category, automated coding and charge capture, being able to automate the coding process for the clinic, having the level of work that a clinician, that a staff is doing, a care staff is doing for the patient, and have that be appropriately reimbursed is it seems like a simple thing, but it is not. And it has such a ripple effect, because it speeds up the revenue cycle. It allows the practice or the hospital to get paid quicker, and it prevents rework, right? When a claim gets kicked back to the clinic or to the doctor, they have to do something and take additional action. Again, just continuing that burden. We also can talk about denial prevention, as I mentioned, and eligibility, right? These are just the tip of the spear, right? Eligibility, meaning before you even see a patient as a nurse, as a staff, as a hospital, as a clinic, you are going to get paid. That patient is eligible for the visit for that day. On the right-hand side, we see clinical decision support. Again, a super popular category. We're seeing a lot of traction with our partners and our customers who are interested in some of these categories. Things like patient resources, being able to generate patient resources directly from Dragon Copilot through an app or an agent, and then be part of that discharge packet. Drug interaction safety checks is another one, true, right? Right in the moment of care, if a clinician is placing an order, it will reconcile and prevent and propagate up what their existing medication list looks like from the EHR, and actually create a safety check or an interaction check for the clinician to let them know that there is a potential interaction error and that they should take appropriate course of action. So these are just the beginning, a tip of the spear with where we're going after the different AI apps and agents for our partner use cases. And when you look at the actual early cohort of our partners, today and now, if you see the yellow stars, those are our partners that are currently today live in the Microsoft Marketplace. There's an actual Dragon Copilot section now within the Microsoft Marketplace. And so Dragon Copilot customers can actually go into the Microsoft Marketplace, purchase these apps and agents, and actually enable them and turn them on in their Dragon Copilot environment. Again, turning that on and allowing their clinicians in workflow now to have the different information, whether it's coding support, clinical decision support, vocal biomarker analysis, which is what Canary Speech provides. But again, this is just the beginning. We are rolling out many more partner apps and agents in this coming quarter, in the coming months, and year. So we're super excited and excited to drive this value for our Dragon Copilot customers, but also for our partners too. And with that being said, I want to pass this over to Felipe, and he's going to talk a little bit more about the marketplace itself.
Yeah, Paul, this is super exciting seeing how Microsoft Marketplace and Dragon Copilot are coming together, because essentially Marketplace is not just a catalog of solutions. You can think about it in this context as really the way that organizations are extending Dragon Copilot with those partner build AI apps and agents. addressing more specific healthcare scenarios. And that means customers can discover those solutions that fit their workflows. They can evaluate those trusted partner offerings that we have on the marketplace and connect those capabilities into the Microsoft environment much more easily and seamlessly. So if Dragon Copilot is the workflow foundation, you can think about it that way. Marketplace is the ecosystem. It's that layer that helps organizations expand value through specialized partner solutions. And this is really where Marketplace becomes especially powerful within the ecosystem, from discovery all the way to deployment. Because at the start, organizations can discover those AI solutions that are relevant to those healthcare workflows. Specifically, as Paul mentioned, selecting Dragon Copilot as a filter in the Marketplace experience. And then they can continue to procure those solutions that have been vetted with reduced friction. Marketplace is helping accelerate that procurement process. It's helping provide those ready to deploy solutions that have been vetted by Microsoft and are platformed to work with Dragon Copilot. So essentially, you're removing that friction of having to onboard the vendor, go through the contracting process, everything with the added benefit that it's all billed to your Microsoft invoice. And third, you can deploy those solutions directly into your clinical workflows. And that matters because one of the biggest barriers to AI adoption is not just finding the right use case or the right solution. It's really moving from evaluating something, a solution, an application, to real operational deployment. And that's where Marketplace is helping customers close that gap by making it completely simple to connect that demand, that procurement, and that deployment through one single platform. And depending on the scenario, we also see customers choosing different paths. Marketplace has the largest selection of cloud AI apps and agents. And in some cases, we see customers that are building custom capabilities from Marketplace. In other cases, they will buy those proven solutions that we have available in the catalog. And in many cases, they're also blending the two, for example, with connectors and other types of solutions that help them combine their own environment and workflows with some of these partner-built solutions that are helping them accelerate that time to value. So now we'll turn it over to some Q&A. Justin, I'll turn it over to you.
Looks like Justin's on mute.
Yeah.
Sorry about that. I was so excited. Thanks, everybody, for joining again. And thanks, Paul and Felipe, for that great presentation. Again, we do have time for a Q&A. So if you are joining us live, it's not too late to submit your questions. First question, can any partner publish an AI app or agent?
Paul, you want to take that one?
Yeah, of course. So right now, and we'll flash up the resource around the MS Learn document around how to build your own AI app or agent. We are in a preview phase right now. So we are encouraging, for interested partners, they certainly can learn and begin to build. But in terms of publishing, we are still monitoring in a preview phase. But we do look to expand that to a general availability later in the summer.
Great, thank you. Next question. I am a Dragon Copilot customer. What is the process to enable? How do I get an app or agent in Dragon Copilot?
Great question. So the process is similar to any app or agent or solution in the marketplace, in that the Dragon Copilot customer, which ostensibly would be a healthcare customer, a hospital or a clinic, could go to the Microsoft Marketplace and go to the Dragon Copilot section that Felipe mentioned, and is effectively purchase the app or agent, and then in the Dragon Admin Center, which is their admin center where all the sort of administration happens and licensing happens, the customer would be able to turn on the extension or the app or agent, and that would then effectively turn on for their Dragon Copilot environment for clinicians to then interact with and actually use in their settings.
Got it. Thanks, Paul. Next question. Do I need to contact the partner to buy?
No, I can take that one. That's actually a common pattern that we see in marketplace. Customers can engage a partner and work with the partner to obtain what is called a private offer. So that is an offer that has custom terms and conditions, custom prices. The customer will negotiate that directly with the partner. So that's a capability that marketplace supports. The partner will create that private offer for the customer, and the customer through marketplace will be able to accept the terms and conditions of that private offer and then deploy the application. So that is a common pattern that we see. We see customers purchasing directly from the marketplace without engaging the partner. But in some instances, if they want to negotiate and leverage private offer capabilities, that is something that the marketplace supports as well.
Thanks, Felipe. Next question. How do we get started?
Yeah, so I think that's a great segue for the set of resources that we have here available for everybody. We have resources for customers where you can visit our marketplace website at microsoft.com/marketplace. There you will find demos, case studies, and you can access documentation, learn more about marketplace, how to purchase, the benefits, the capabilities, and also learn more about Dragon Copilot. And if you're a partner, we also have resources for you, so you can learn how AI apps and agents for Dragon Copilot work and how to build your own with the link that we have on the screen. Okay, I think is that the last question we had?
Yes, that's the last one for now. So I think we can transition to that resource slide in just a minute. So we'll end on that resource slide. Before we get there, well, actually, yeah, let's go over the resources first.
Yeah, so as I was saying, these resources that we have available for customers, visit our marketplace page at microsoft.com/marketplace. You can find videos, demos, understand how to purchase, the different purchasing motions and case studies. And if you're a partner, we have some resources available through that link that you see on the screen for partners, so you can learn how to create your own, build your own AI app and agent and publish for the marketplace.
Great, thank you. And for partners, that link was aka.ms/Dragon Apps Agents. Yeah, that was it. So, okay, great. Thank you, Paul. Thank you, Felipe. We can go ahead and wrap up. Any closing thoughts from either of you?
No, I would say we're in a very exciting time with AI, and it's great to see how Marketplace is supporting scenarios like Dragon Copilot, the AI apps and agents. This is a great space for us to be partnering with Paul's team on. We're very excited about the partners that we have there and the capabilities and enabling customers to purchase through Marketplace and simplify their procurement process and time to value. It's great to see healthcare coming into Marketplace with these type of solutions.
Yeah, I totally agree, and I think we're in early days. Like I said, we're just at the tip of the spear around the different partner apps and agents and the use case categories. And the great thing we're trying to drive here is that we understand Dragon Copilot can't do everything natively, and so we're working with best in class organizations and partners to drive and to bring their use cases to the marketplace, and to really provide that unique and great experience for our Dragon Copilot customers to go and purchase and turn on into their environments and to really streamline their care process.
Awesome. Thank you, Paul. Thank you, Felipe. All right. Thanks again, everybody, for joining. We will go ahead and wrap up. But again, thanks again for joining today, and make sure to visit our community resources at aka.ms/community/marketplace. Thanks, everybody. Have a great day.
Thank you.
Thank you.